Breast cancer is considered the most common form of cancer in women in the United States, according to the American Cancer Society. An average woman has a 1 in 8 chance of developing breast cancer in her lifetime. Now, one hospital system in Bangor is improving its cancer detecting technology. News Center Maine's Caroline LaCour explains how it'll help patients in eastern Maine and beyond.
Investing in the healthcare for eastern Maine and beyond, St. Joseph Healthcare is introducing 2 more 3D mammographic systems under its belt.
At the end of the day, 2 new machines is good for the long-term benefit of all people because it ensures the machines will be working well.
Thanks to federal funding secured by Senator Susan Collins and Angus King, President Brad Coffey hopes the addition will allow for earlier detection and less false positives for patients. After dealing with one himself, he empathizes with the stress many patients can go through.
I know that during that period of time from the actual mammogram taking place to the time you get that call or the results, there is some stress. The reduction in those false positives is a real plus.
The hospital upgraded to 3D mammography in 2016. Paired with Profound AI, the tech translates to better detection, images, and more comfort when screening. Lead mammographer Lori McLeod says after 42 years with St. Joseph, working with the equipment has been much more assuring when looking for concerns.
Less chance of them calling them back for extra images because they can get so much more out of that one exam and not wonder like how deep it goes in the breast. You actually can look through multiple slices.
Breast cancer survivor and leader of Open Arms, Brooke Ismail, understands the importance of early detection and says making that call for your yearly mammogram is what stands between you and stopping cancer in its tracks.
It was me knowing my own body, doing self-exams, which is super important too. I knew there was something wrong, so I was being my own advocate.
Striving for stronger defenses and earlier detection for all patients in Maine. In Bangor, Caroline LaCour, News Center Maine.
Now, St. Joseph Healthcare tells News Center Maine that you want to be aware of the signs of breast cancer. And although it's common to be concerned about a lump, which could be a sign of cancer, any sudden changes to your breasts you're not familiar with should also sound that same alarm. According to the American Cancer Society, these changes can range from swelling, skin dimpling, to pain or even discharge. Lastly, make sure to schedule your annual breast exam starting at age 40.